So again, welcome. One of the wonderful things about using video conferencing is that we can see each other virtually. And so we really encourage everyone to turn on your camera if the bandwidth permits it. We're building a virtual community of practice, and seeing everyone really helps with that. So please join us if you can, being on camera. Please keep your microphone muted during the session unless you'd like to speak up and ask a question or make a comment, in which case raise your hand or send us a message and we'll be able to unmute you. If you can, please rename yourself with your name and your organization so we know who you are and what organization you're with and maybe even what country you're in. If you've got any IT challenges with Zoom, please chat EcoIT. So that's one of the Hollywood squares, and ask them for help and they will try to help you. So we'll try and reserve the chat function, the general chat function, for questions and comments. And please refrain from noting your attendance in the chat. We've got a different way we're tracking attendance. And that's with the PDA participant app. And hopefully many people noted that in the announcement. If you've already downloaded that app, please scan the QR code to the right. If you haven't downloaded it, we're going to take a few moments to give you time to do that, because we're really trying to get all the participants using the app so we can pilot it. And we want to thank our friends at SEAOHUN for sharing that with us to pilot this. So you would go to PDA-participant in the Google Play Store or in the Apple Store and download the link. There are instructions in the announcement as well. And then there will be an end QR code that's different toward the end of the session. The presentation slides will be shared instantly via the PDA participant app, and also we'll email them out to everyone who's registered after the session. So the session is being recorded and your attendance is consent to be recorded, so thank you for that. There's also going to be a link to the COVID-19 One Health Update social media guide. We'll put that in the chat if you want a little recommendations on how to optimize your social media use related to these sessions. And there will be continuing professional development credits available through the University of New Mexico, and we'll share a link in the chat at the end of the session. So now I'm going to bring up a couple of other slides related to the SEAOHUN participant app, and hopefully you can see those here. So it's a participatory digital attestation app. We're test driving this app, and the whole point is to give you, the participants, a attestation of your attendance in these sessions that will be portable, in which you can carry and which you can share if you want to with professional colleagues, and it will give you instant access to all the PowerPoint presentations. So to find that, put in PDA participant, either in the iOS or Android Play Store, and then you want to download that. It'll then prompt you after you've downloaded it to sign up. All you need to put is your name and your mobile phone number. You will then get a confirmation to your phone number through that. Once you've downloaded the app, there are only 3 buttons. It's a very simple layout. On the left, there's what looks like a little rubber stamper, which is the attestation section. And initially there'll be no attestations, but at the end of this session, you'll have your first attestation, and you'll be building a library of these attestations. The middle button is the scan in, scan out button, and it launches a QR code scanner, and that's what you'll use to scan the QR code. And then on the right is your profile, which you can edit. There's also a little notification button at the top right. So to operate that scanner, you just click on that middle button, and you'll be able to scan that start code, which I'll put up again, and then use that again at the end. So once you scan that start code, you'll get a blue or a check mark with a blue halo, and that is confirmation that you've registered your start to the attendance. And then at the end, there'll be another QR code and you'll get a green halo around a check mark. And after that, you will see that you will have your attestation starting. It'll also actually have a QR code on that attestation that any colleague of yours could scan and get access to the content that you will have by having participated. If you swipe left on that, it'll show you more detailed information about the session, today's session, and include the different PowerPoints, which you can also share via WhatsApp or email with colleagues. So hope that was easy. Hopefully many of you have gone ahead and downloaded that. I will very quickly just show that QR code again before we get started. Hopefully anyone that's downloaded it can take a moment and scan it. And with that, I'm going to stop sharing and pass the baton to Professor Jonna Mazet to formally welcome us.
Wonderful. I did it, so it wasn't too hard. Thank you for the great instructions. Welcome to our ECHO session for the One Health Workforce Next Generation, really specializing in the community of practice on COVID-19, and I'm super excited about today's subject matter around what's working and what's not working and how to attack this thing with all of your expertise coming to bear. Happy Earth Day, everyone, and I think it's a special day to remember the wonderful things about this planet and how connected we all are. We don't probably need a reminder because almost all of us are sheltering in place and trying to help flatten the curve for COVID-19, but it is certainly a day to remember how connected we are and how what we do as a species affects all the other species on the earth. So with that, I would like to hand it over to my partner from the SEAOHUN Secretariat, Dr. Vipat, to welcome you.
Anywhere in the world, regardless of where we are. So the Southeast Asia One Health University Network is very excited to co-host the COVID-19 One Health update sessions. So this is the third session that we have. So we are a group of universities that aim to develop a resilient and competent One Health workforce by leveraging education, research, and training providing by our members university in Southeast Asia. So today, if you have joined for the previous two calls, today is going to be a little bit slight different format. We're going to have more of the panel discussions, and we're going to have the four people from our member universities sharing their experiences. So we're excited. So we have been experiencing with this pandemic of COVID-19 since earlier this year. So each country has been implementing their policy or the engagement or involvement, try to flatten the curve and try to combat with this pandemic. So right now we have a tremendous experience and learning a lot of things along the way of what's worked and what's not really worked. So today we're going to hear from our partners for that. So without further ado, so I pass the floor back to, I don't know who, Bruce or Watrina.
Yeah, I think next on our agenda, we're going to go very briefly to Dr. Brian Bird, who can give his usual global updates and quick intro. And then Dr. John Epstein will be moderating the panel discussion. So folks are welcome to share additional questions via the chat box as we go along if you like, and we'll cover those to the extent we have time, and then we will post updates to the FAQ webpage as well to try and address additional themes and questions that we didn't have time to talk about tonight. So Dr. Bird, perhaps you want to take it from here. You're muted perhaps. Dr. Bird, are you on mute?
Sorry about that. When you're muted but sharing your screen, you can't unmute yourself. That is a challenge. Okay, hang on. Here we go.
Okay, so do I?
All right. So welcome back, everyone. This is our third time together, and I'm delighted to be back with you talking about One Health Workforce and what work we're doing around the world together to try to fight this global pandemic. And this title of this session is What's Working and What's Not. So I'm hoping we have some really nice, honest, and open discussion about really what's working and helping and what things seem to not be working as well. The more we can share information, the more we will get through this pandemic together. And here on this slide are just some great examples, I think, of work already being done, shared by our colleagues at SEAOHUN and health educational flyers, and then a great shot of the team from SEAOHUN wearing a PPE and demonstrating how that is done. Because working all these things together, we can stop the global spread of this virus. So just big picture updates, so everyone's on the same page. Today, the case count indicator for confirmed cases was about 2.6 million, so 185 countries. In the SEAOHUN region, just looking at those countries alone, what I could count from WHO website was a bit over 22,000 cases. And to update on some other things I talked about previously, in our first session, we talked about roughly 10 vaccine candidates. That's now well over 60 potential vaccine candidates in development, and at least 5 of those are already in human trials. So that's a great step forward. And there is increasing evidence that some antiviral drugs may have effect against SARS-2 coronavirus. One example that might be remdesivir. But the definitive studies aren't completed yet, so we need more time and more data, but it will come. So hopefully we will have medical countermeasures. But as we talked last time, it's important that we keep in mind our community of practice and our community surveillance efforts, and that we're all in this together. Pharmaceutical interventions won't be alone sufficient to stop the outbreak. And thus far, there's no strong evidence that any particular viral variant is more or less pathogenic from what has been sequenced so far around the world. And in the next slide, I just want to point out, I came across a really excellent resource for visualizing data for COVID-19. If you see the link here in this slide in the lower right, ourworldindata.org, they have a COVID-19 specific section, and you can yourself customize wonderful charts that help you examine the differences of between countries, between efforts in regions, Africa and Asia, individual countries. And if you look at this total confirmed COVID case count, you can see there are variations in the total number of cases in every country. And I'm hoping today we can drill down and understand why that might be. Is it social distancing measures? Is it wearing a face mask? Different government policies that are being effective? Community engagement and surveillance, or things that I haven't even thought of? I'm really excited to hear from you. And as always, the last slide in my presentation here is just links to all the informational sources where I'm drawing this information from. So with that, I'll turn it back to my close friend and colleague, Dr. Jonathan Epstein from the EcoHealth Alliance, and he will carry on with the moderated panel discussion. Back to you, Dr. Epstein.
Thanks, Brian. And it's wonderful to see all of you virtually, many friends and colleagues on the call tonight from around the world. So pleasure to be here. I'll be helping moderate tonight's discussion. And I think from a personal perspective, what's interesting about this particular conversation, where we have the opportunity to hear firsthand from colleagues in different countries as to what measures are in place and how countries are handling the epidemic specifically. I'm sitting in a place, one, that happens to be the epicenter of much of the transmission in the world, and that's New York City. And two, the United States is almost living a similar experiment to the rest of the world, in that we have different parts of the country enacting different policies rather than a uniform policy. And it's interesting, we're going to start seeing the relative differences and impacts of parts of the country that are still in tight lockdown, like New York, versus other parts of the country where the case counts are still relatively low and are beginning to plan an exit strategy for kind of reopening. And we'll see disparate parts of the country, but I suspect that's going to be a reflection too of cases in different parts of the world based on the situation in different countries. And one of the great strengths of the SEAOHUN network and the AfroHUN network, the One Health network in general, is the ability for us to speak with each other in this kind of forum to really get some insight from a firsthand perspective as to how things are going, what's being done, and how things are working. So I'm looking forward to tonight's conversation, and with that, I'll introduce our first speaker. Tonight we have speakers from Vietnam, Malaysia, and the Philippines. And I know there are many of you on the conference tonight who represent other countries and different sectors who could probably make wonderful contributions as well to the conversation. So in the second half of our presentation, we'll have an opportunity for some questions from participants in the call. So without further ado, I'd like to invite our first speaker to spend a few minutes talking about the situation in Vietnam. And this is Dr. Le Thi Huong from Hanoi Medical University. I believe that you're the Dean of the School of Preventive Medicine and Public Health. So welcome tonight. We haven't met before, but I'm really interested in hearing your perspective on the situation in Vietnam. So please, over to you, Dr. Huong. And just make sure that you're off mute if we don't hear you. Okay, I'm actually looking for our speakers box in here so I can help unmute.
John, it's Bruce. Have you seen if he's signed in or?
Yes, she was here earlier.
Great.
So. Oh, but it looks like she may have dropped off. She's no longer present.
Do you want to move on to our
Let's do that, yes. Okay, so then let me invite our next speaker from Malaysia, Mohammad Rohaizat Hassan, medical lecturer from Universiti Kebangsaan, Malaysia. And welcome. And we have just before you begin, we have two speakers from different universities in Malaysia, and I'm sure you have different perspectives. So it'd be wonderful as we go. The types of things we'd like to hear about are of course, the current situation, the types of measures that have been put in place in Malaysia. And Malaysia is really, you know, from my perspective, has done a nice job in terms of managing this outbreak. So really curious to hear some of the technical measures that are in place and each of your insights as to how things are and where they're going. So over to you. Thank you.
Okay, thank you very much. Good morning, everyone. My name is Rohaizat. So I am from the National University of Malaysia, one of the SEAOHUN members. So thank you very much for giving me opportunity to this morning. Everyone can hear me? Okay. So basically, just to share my experience, I'm now in charge of the operational room in the hospital of the National University of Malaysia, handling the COVID-19. So it's a kind of different settings from our Ministry of Health, because we are teaching hospitals, but at the same time we are the COVID-19 admitting hospitals. So we are taking COVID-19 into our hospitals. So I would like to share with my colleagues. Farhan will be sharing more on the Ministry of Health setting, because he's very much involved with the Ministry of Health activities down there. But I will be sharing with you on how our setting in the teaching hospitals in handling COVID. Basically, as you mentioned, that our country, Malaysia, is implementing a very strict MCOs and extended MCOs in containing this COVID-19. And as part of it, our hospitals also has done something very great, of which we started with preparations by classifying our staff into a few different categories to reduce the exposure to COVID patients. By number one is we are classifying our staff into critical clinical staff and critical non-clinical administrative staff and non-critical staff. So those are non-critical, we keep them work from home and we keep only very minimum staffs, which is critical in the hospitals, so that we can manage to contain the exposure for them towards COVID-19. So that's what we did for our preparedness. And so far, we have done quite an excellent job protecting our staff from getting infected by COVID-19. So following the MCOs by the government. Okay. Well, to the second question, I can share on our preparedness. Is it affects the other services in our healthcare facilities? Of course, it's a bit affected because we have to close some of the outpatients clinics, everything. But mobilizing the staffs from one area to another, we managed to do two things at one time. On one section, we managed to provide the services to the admitting COVID-19 patients, and on the other parts is we are still continuing to those patients with chronic diseases which needs to be seen by the specialists, like those who's on antiplatelets, anticoagulants, everything, and on dialysis. So we managed to do that, so that business as usual for most of the critical services. But of course, we are focusing very much on the COVID-19 admissions. So far, we have around 140 admissions already in our hospitals. So regarding the informations, of course, I am in charge of the operational room, and we kept the data very, with privacy. We don't really reveal, as did by our Ministry of Health too. We don't reveal so much on the, we don't reveal the data on the case and contact. So it's within our operational rooms database, and of course, for how to, of course, there is a stigma and there is an anxiety among our whole hospital staffs regarding this COVID patients, positive, everything. But for that, we have a very good risk communications group, which gives them the clear informations. We tell them how many cases per day admitted, and they are, our priority is always to keep them safe. So with that kind of risk communications, we manage to keep the data safe and keep our staff not in anxiety or having a stigma to the patients. I think that much for now I will share. If any questions, maybe can be asked later. Yeah. Thank you very much.
Thank you. I just wanted to follow up with a question, and we'll take questions from the broader group after the presentations. But one thing that came to mind when you were speaking, so Malaysia, have you experienced hospitals reaching capacity at this point, or what are you seeing the levels of hospital admissions in your hospital, let's say?
In my hospitals now, we have around 180 beds prepared for COVID-19, but now the BOR for COVID is around 45% at the moment. So we are still have very much space to accommodate. That's for my hospital, basically.
And have you, and this is a question I'll ask each of the speakers, but is there discussion at this point, this is a conversation that's beginning to happen in the United States in terms of serology and identifying healthcare providers who have recovered from infection, and then identifying members of the general public who have recovered from infection and potentially have immunity. Are there similar conversations happening within the hospital there?
We are discussing about that, but we have not started yet on the seroprevalence study. But there will be soon. We were thinking of looking into the seroprevalence of the, especially towards our staffs, who is whether 100% involved or partially involved in managing COVID-19, to see how much they have been exposed, to look into their antibody and everything. The study will be, I think, will be up very soon on that.
Fantastic, thank you. Thank you very much for that overview. It was wonderful. Let me introduce our next speaker, also from Malaysia. This is Dr. Mohammad Farhan bin Rusli from the International Islamic University. Please, Dr.
Hello, everybody. Can you guys hear me well? All right, thank you, and a very good morning to you. I'm actually calling from our operational base right in the epicenter of the capital city in Kuala Lumpur. As you can see behind me, I'm always gathered by the police. For some reason, they say that security is always the best priority. So please excuse them. But they will not leave. Anyways, where I'm based at is actually where there is the highest number of concentration of COVID-19 cases that's detected in Malaysia by constituency of the medical coverage, which means that in our district, the highest number of cases has been in this area for the past 15 days, if I'm not mistaken. So we've always been number one, but we would not like to be number one in this case. Getting to your questions that was posed earlier regarding social distancing, what I can say is that in our areas where we have actually done the enhanced movement control order, where we do targeted lockdowns or targeted enhanced control movements, we see that we are able to put them in a specific zone so that they don't leave. So we keep them in an area that's enclosed. But one of the potential problems is that the enforcement inside the building itself poses a threat, because we see that there are still movements inside. They don't stay in their own homes as what we would like them to. So we still see movements inside this control order areas, and we see that there are some secondary infections that are coming along, second generation, third generations, even after we've actually limited their control movement. And I think that in a sense, this can also be learned in other areas or in other high density areas, such as probably New York or in the UK, because you might think that outside the buildings, everyone's adhering to whatever you're imposing on them. But maybe in the building itself, we need to be more diligent in making sure that they do not move from area to area and do not use common facilities. And one of the targetings that we're actually doing is the migrant workers, our migrant workers. We have a lot from Bangladesh, from India, and from Pakistan. And one of the barriers that we see happening is that they do not fully understand, maybe because of the language barrier, but we've overcome that by the health ministry engaging with different embassies and giving specific instructions to different people to actually ensure that they understand what's going on, and they understand that we are not out to get them per se, but we are actually out there to help them. And I think in this case, the interagency linkage and the communication between all the agencies plays a very important role, because we see that the health ministry will not be able to actually complete whatever task they need to do if they do not actually link all these other interagencies together. And I think that we see the improvements coming in Malaysia, and we're learning every step of the way. And we see that the interagencies are working together and they're more in sync. And we see that the progress is getting even more and more better. As for the needs and information for patients, one of the things that I think is a subject to actually ponder on is that once we detect positive cases, what we do is that we transfer all the other close contacts into specific quarantine centers. So when you talk about a high-rise condominium where we actually have to move people out, obviously other people are going to see those people move out. We see some limitations in whether we should actually disclose whether these people are actually being moved because they are close contacts, because we do not want them to be stigmatized. Because I think one of the biggest fears that's happening in the world today is that if you're COVID, that means no one's supposed to touch you, no one's supposed to help you, you're being pushed away. But what people don't understand is that nobody actually wants to get COVID-19, nobody wants to get the coronavirus, and we should not treat them as though they are, they're aliens or something like that. We should treat them as though they are patients. They have a virus, they have a disease, we need to help them. And everybody in the community needs to make sure that they do enough to make sure that it doesn't spread out even more. And I think that's a message that we need to send out to everyone across the world. I mean, you should not stigmatize anyone with coronavirus, just how we overcome people with HIV and how we overcame that stigmatization. I think we should implement that for COVID-19. Thank you.
No, thank you very much. And actually, I'm glad you raised that point. I think the stigma aspect of this is incredibly important. And one of the most challenging things about this whole outbreak is how insidious this virus is. And the fact that there's asymptomatic and pre-symptomatic transmission means that people could feel and look perfectly healthy and still be transmitting this virus. And so it's very much not a shameful thing to be infected, because you really have very little way to know if you're even exposed to somebody who is, or if you yourself are. And for that reason alone, I think that we need to do everything we can, to your point, to reduce and remove any feelings of shame for being infected or exposed, but really work together to limit risk there. One question I wanted to ask you was, what is communication like? You mentioned sort of interagency communication within the government, but what's the communication been like in Malaysia to the public from the government? Is there a central point of communication, a person, a figure that's speaking to the public? What forms of media are being used? What's it been like?
As for the dissemination of information, currently our Director General of Health is the one who updates regularly every day at 5 p.m. You can, our time, so you can actually follow up his live coverage at 5 p.m. every single day. He's the point person on updating regarding the health aspect, the public health aspect of the COVID-19 updates. And we have our senior minister who is actually updating on the security measures that's being imposed, such as the movement control order, and special announcements are made by the Prime Minister itself. So usually we have three point persons, and this is to ensure that the public gets transparency, they get the right information, they know that they are having the information from a trustable and a verified source, because early on we had to combat with so many different versions of events happening. So the more transparent we were with the public, the more the public learned to accept whatever control orders or whatever we needed from the public to follow. And we see that the public are now more understanding and they are being more helpful, and they themselves are actually policing, or they themselves are actually enforcing whatever we are asking them to do. And it's a very, very good acceptance rate from the public itself.
That's fantastic. Trust is so important. Yeah, trust in the people who are giving you information. So I'm glad to hear that that's been a good process. Thank you very much. At this point, I'd like to invite our next speaker. This is Dr. Berba Regina from the University of the Philippines College of Medicine. Dr. Regina.
Hello, good morning. Yes.
You have some slides to share with us, right?
Okay. Oh, but it says host disabled participant screen sharing. Can you?
Bruce might need to make her a co-host to be able to share her screen, which I think should be doable. Yeah.
It's already done.
Okay. All set.
Okay, so I'd like to just start off with how we were in January when we didn't have any confirmed cases at the time, going to February when for a long, long time we only had 3 confirmed cases in our country. And then by March, this was the situation just before the surge. And this is where we are now. We're up to 6,000 plus cases. And this was what happened that led to the very untraditional strategy of the government to impose a lockdown. So I described to you the early pre-surge events when we started to just have 5 cases, and very soon, over just a few days, we were doubling very fast. So that by March 12, the code red sub-level alert was given by the Department of Health, and the quarantine was imposed by the President of the Philippines. So this is how we labeled our alert levels. And by March 15, there was this presidential announcement telling us that we will be on lockdown. This was initially just the National Capital Region, but after a day or so of experiencing what it was like to be on lockdown, the president announced that he will expand the community quarantine to the entire island of Luzon. So this probably close to about 70% of the entire country population belongs to the main Luzon island. And this expanded community quarantine meant there were no mass gatherings allowed. The entire public transportation was closed. School was closed. So students would remember this very well because everybody was then preparing for graduation or final exams, and suddenly schools were closed. Everybody, all establishments, both government and private, had to work from home. There were just very few skeletal forces and the basic workforces like for health services and for security that were allowed to keep on working. All establishments were closed, all the malls, everything was closed, and persons were supposed to just stay at home. You need a quarantine pass from the local government for you to be able to drive outside your home. And that's usually allowed only to purchase food or medication. So the Philippines started to look something like this. There were a lot of checkpoints that was manned by either the army or the police forces. And our airports started to look like this. There were all operations were suspended. International flights were not allowed. Everything was canceled. And what used to be very, very, very congested areas in various points of the city is now always almost empty. So for example, when I need to go home, I would be alone in an entire highway. Nobody else is driving with me. And people would be allowed, very little movement was allowed, both in the city and in various points in the island of Luzon. So that's in various provinces. So people would really be also wanting to stay at home because they didn't want to go through this difficult processes of having to be checked at checkpoints. But fortunately, things were under control. There were really no abuses that were reported. Many people, perhaps there were a number of people who were said to be not compliant to the quarantine, but for most part, people were really behaving. There were no rallies, there were no major protests that happened. People seemed to understand what the government was trying to do. The Philippines is predominantly a Catholic country, so when the Holy Week, the Lenten season, culminating in the Good Friday and the traditional Holy Week events, it was very, very, very difficult. So people really also complied. There were no church gatherings. The traditional celebrations and commemorations were all held online. So now we're almost nearing the end of the quarantine. So initially it was March 15 to April 14, and during April 14 they announced that they will extend it to April 30. So everybody is now trying to figure out what will happen beyond April 30. There's the UP, the University, very good analysis what this quarantine strategy ended up as. And they mentioned, they analyzed it, that the lockdown actually lessened the rate of the coronavirus infections. This is seen in this particular policy statement from our university. And in the graph here, it would be very clear that there was actually a significant reduction in the R, in the reproductive number. So that right now, the R number is less than one at this time. So, however, this group also said that if we lifted the ECQ just like that, we should anticipate a resurgence of the COVID-19 cases. So now we're really awaiting announcement of what will happen post April 30. There's been a lot of recommendations, and we think that what will happen will be a graduated back to normal kind of lifting of the quarantine. We also, the University of the Philippines is also the National Health University hospital. This is called the Philippine General Hospital, and we were actually selected to be one of the COVID-19 referral centers. And what works for our hospital is that we follow certain clinical pathways and algorithms. We have a lot of experts who are working with us here. We've been able to upturn and overturn our hospital. So now we have a maximum of 130 beds, all in cohort bed placement, to be able to accommodate the COVID positive patients. We also network with the community quarantine centers. And over the past several weeks, we've had many innovations that came out from us being a referral center. So we've been working on alternative options for the personal protective equipment. We have the Telekumusta. This is a way of allowing communication between the family and the patient who are in the isolation areas. We also have been able to, one of our scientists at the National Institutes of Health have been instrumental in putting together a test kit that actually is being used now to facilitate testing for COVID-19. So that's a very remarkable contribution to the national efforts to control COVID-19. There are many other innovations that are coming up. Other things that work, there's a policy that came out. It's called, it's a law, Republic Act number 11469, that allowed government to relocate, realign, and reprogram the budget. And that seems to also help significantly facilitate movement of funds to enable operations to be facilitated and respond well to the COVID-19 needs. And my own take here is that what works for me as a frontliner is, number one, just like Malaysia, we really look forward and wait for the daily updates from the Department of Health to give us the dashboard, daily dashboard of what's happening to the rest of the country. We are very fortunate that number two, there's like a unified guidance from our professional societies, like the Philippine Society for Microbiology and Infectious Disease, giving guidelines on how clinical care would be. And number three and number four is something that I think really contributed very much to how we've been able to cope with the COVID-19 problem. These are donations of PPEs and the Bayanihan support system. Bayanihan is a word that means collective effort. So there's a lot of donations, both from government and from private companies, families, schools, organizations, friends, and just regular individual citizens trying to pitch in whatever they can contribute to the healthcare system. And number 4, because we're in lockdown, when we work in the hospital, there's really no source of food other than the donated food from different people. They also have been able to provide transportation because the public transportation is not in operation. So there's like donations of buses, drivers, bicycles, all allowing health frontliners to come into work. And of course, hotel accommodations for the frontliners because they couldn't go home anymore. So what may not work? There's a lot of talk about mass testing. So this is something that we need to work out. What the contribution of mass testing will be, and that we need to just be very clear on planning and implementation of the expanded testing strategies. Okay. So what's awaiting us now? Again, the COVID team from the university is recommending graduated activation after April 30. There's another policy statement they came out with saying that maybe this time it could be a modified community quarantine depending on what the potential for outbreak would be of particular parts of the city or provinces within the country. So, of course, we're all aligned with the WHO strategic objectives. I'd just like to end with the concept of bayanihan, because I think this is really what's also very unique for the Filipino culture. Bayanihan is, as I said, the Filipino word that translates to working together, leaving nobody behind. It's working for the greater good. So being community is all part of it. So just as a summary, I've spent a lot of time talking already. I think these are the key points that most likely work for us here in our country. Number 1, it's really the timely lockdown of a large portion of our country. Number 2, it's the leadership and unified action, both from the government. They're an interagency task force working on this. Of course, our Department of Health, the society, the Philippine Society of Microbiology and Infectious Disease, and our own University of the Philippines and the Philippine General Hospital being a lead in most of the innovations that's happening. And of course, I really think that most of it is also the collective effort, the bayanihan spirit of the Filipinos, along with these efforts of heroism and generosity. That's it for us. Thank you very much.
Thank you very much, Dr. Berba. And it's wonderful to see the control measures being so effective. Just a quick question, as I was thinking about this, so you were talking about the focus of the lockdown being in the Luzon region, but can you describe a little bit your impression of control measures outside of that area? And what goes with that is wondering if you could describe a little bit about the level of testing, because, and we'll talk about exit strategies, but of course, as we start to understand situations and move towards perhaps coming out of lockdown, testing becomes so crucial. What's the testing been like in the Philippines, both in terms of penetration into areas outside of Luzon as well, and what's your sense of the control measures that are happening there as well? Thanks.
We think that most of the infections actually really started off in the National Capital Region, and then it's really the travelers that moved out of the city to the provinces that contributed to the number of infections that have been happening. There's been some spotted areas like in one city in Cebu. It's a city down in the area of Visayas, but these are few and at this point manageable. So the testing, we're mostly still based on the RT-PCR, but there's now movement of purchasing, as I said, the antibody rapid kits. But again, we need to be very vigilant on how this could be used so that they're used well. And we really have been trying to expand the number of testing using the RT-PCR. But there's more testing sites now, the laboratories, like our university is linked to the National Institutes of Health, which is contributing a lot already to the percentage-wise, the number of tests that are being done on a daily basis. But I think it could still be improved, and I think we're improving on a daily basis. Yeah.
Thank you. That's terrific. I noticed that our speaker from Vietnam has rejoined us, and I wondered if Dr. Huong Le Thi would like to present perspective from Vietnam. I wanted to give you an opportunity to present, and then we'll go through some Q&A with all of the speakers. So Dr. Huong is from Hanoi Medical University. Let me unmute you.
Hi.
Hi
Hello,
there.
everyone. Can you hear me?
Yes, we can.
Oh, yes, because this morning is not very good, the internet connection, but I hope that it can be through now. And I have received some questions from the organizing, and then I will one by one to go through it. First one is how is social distancing being implemented in our country? So Vietnam began the nationwide social distancing within from the 1st April, and with the principle of every household, village, commune, district, and province going into self-isolation, according to the latest directive by the Prime Minister Nguyễn Xuân Phúc. And accordingly, the people are told to stay at home and should only go out in case extremely necessary, like buying food, buying medicine, emergency, or essential services, and goods that are not subject to provincial closure. And the government leader also requested the strict observance of keeping an interpersonal distance of at least 2 meters and not gathering in the group of more than 2 people outside the workplace, school, and hospital, and in public place. And after 15 days, the National Steering Committee for COVID-19 Prevention and Control of Vietnam has suggested that the government Directive 16 on social distancing should be continued for another week in Hanoi, taking up from April 22nd and up to today. And today we are free due to the capital remaining at high risk of an outbreak coronavirus. The high risk group represent the locality that have a head case within their community over the past 14 days. Meanwhile, the risk of the group cover local case having infected case within the community over the past 15 to 28 days. While the lowest risk group is a locality that have had no positive case reported within their community for 28 days or more. And as a result, Hanoi has been placed in the high risk group, and Ho Chi Minh City, Bắc Ninh, and Hà Giang are in the risk group. And the other remaining locality are in the low risk group. And today, after almost 1 week, we have no new cases. That's why the president released the decision 16 that Hanoi also can come back to work, and school children can go to school, but we still strict that will not allow the bar or the pub or some entertainment not yet open. That is how we run for the social distancing. And what are the pros and cons from this approach? And we recognize that the pros are including the spread of disease is brought under the control to the extent distancing and other precaution exercise. And we also have the new behavior. Teleworking is put to practice use, and even the telemedicine starting invested and running in some big hospital. And also people slowly get used to home working and efficiency keep on improving. The health awareness level is rise, and a lot of traveling and other risks is reduced that may prove fatal in some instance like road accident. And you also can see that in some other country that environment pollution problem was improved. But we also can recognize that some cons are the first one is a feeling of loneliness is increased, which lead to some psychological problem. And we also observe that some issue may have to deal with the nutritional intake and the number of meals per day, or the food may be not good as a normal day. And we also see that some lack of the exercise, just stay at home, and may lead to the health problem. And some patients maybe have a problem, but they now afraid of the COVID-19, they didn't go to the hospital for check-up or get the medicine. And children have to stay at home, learn through the e-learning, but they feel very unhappy. And the elderly people with the pre-existing medical condition, that is the big problem for us, that they cannot access to the treatment enough. But the big problem also the same for other countries is affect to the economic aspect, that reduce income of the many people. And also we can see that many company, many service have a shutting down, and many people jobless. That is a very big issue. I think that not only for Vietnam but other country. And the second question is how has a health system prepared to respond to the health outcome during COVID-19? So up to now, Vietnam can be considered successful in initially controlling and preventing COVID-19. The health system is strictly controlled regarding first we are zoning the pathogen, tracing and to clearly identify F1 and F2, and require sufficient isolation for monitoring cases. And the second one is people who come back from the foreigner country having COVID-19 epidemic are also isolated immediately to monitor and detect case. And strict border control, not allowing cases of illegal entry into Vietnam without medical examination. And intensive treatment for infected patients, ensuring no mortality. The condition for discharge is first, patient safety is a priority. That is, result of the test must be negative, and all the pre-existing medication has to fully control. And the second is the patient has to join the community safely. And people have to strictly adhere to the social isolation and social distancing. Epidemic prevention measures such as wearing masks and washing hands frequently. Well-prepared equipment and facility for treatment and isolation at different levels, from the central level, provincial level, district level, and community level. And I think that Vietnamese government have a good leadership to involve all the people, all the branches involved in the prevent COVID-19. And the health systems ensure regularly monitoring other infectious disease, and each setting have to immediately report cases of infection when detected via monitoring system. And the third question is how are the need for information of COVID-19 case and contact being balanced against need for privacy and avoiding stigmatization in our community. So we must concern the identity of the patient. Usually we only mention their age, their gender, and where they come from. And we must also keep the name of the hospital or secret. And we do not attach location or ethnicity to the disease. We can target people from specific population, ethnicity, or racial background. We do not refer to people with the disease as a COVID-19 case or victim. We do not repeat or share unconfirmed rumors and avoid using hyperbolic language designed to generate fear like flood or apocalypse, etc. And the balance between protecting individual privacy and collecting information that is critical to the public good chance over the course of the disease spread. Digital checking information is ubiquitous today, and that can make data collection easier. So that is some very brief thing I want to share with you about the COVID-19 prevention in Vietnam. Thank you very much.
Thank you, Dr. T. And it's terrific to hear that you're already sort of making preparations and have thought through well an exit strategy for opening up again. And I'd like to talk about that with all of our speakers. But one question I have for you while we're speaking about Vietnam is, what kind of structural, perhaps permanent or long-lasting changes do you see happening or anticipate happening when it comes to returning to schools, reopening restaurants? These are discussions that are starting to happen in the United States as well. Is what will a restaurant look like now in terms of the density of people it can have in it? What will classrooms look like? Are these discussions that have been had at government levels as part of a plan for reopening?
Okay. As I mentioned to you that today, after 3 months that we have the first case of the COVID-19, and we also have to lock down for almost 3 weeks in Hanoi. But we always have the very high level of the representative of different people for the COVID-19 committee prevention. We very carefully look at the situation every day, and then before giving the Prime Minister and the President giving the decision, we have to very carefully conduct the collecting the idea from different important person that for example, we divide different zone or different province to the high risk or lower risk or average risk, and then we have a policy for each reason that maybe they can start open the school for the children go to class, or we have to keep shutting down the entertainments like a restaurant or bar or some other place that have a high risk of the spread of COVID-19. So we have to look day by day the number of the new case, and also we have to look result of the treatment, and also we have to follow the people that come back from the foreigner country. And once we see that we can control all the things that we may still keep some closed, but open like a small restaurant or a small market. and still keep the monitoring very well of the activities.
Great, thank you. Yeah, it's going to certainly be something I think the world will be watching as countries start to open up again for everybody. And I wanted to put that question as well to our other speakers, and perhaps Dr. Berba, you could speak to the Philippines, and you said that there were starting to be plans to think about exiting as well from lockdown. And what do you anticipate things will look like in terms of how society might work there, and also how monitoring will proceed?
We keep on like talking about the new normal now, so I think people would try to ease their way to getting back to some kind of a new normal. But we're really not very sure what's going to happen after April 30. I think it will be extended for another 2 weeks, and then some establishments will the basic establishments will probably be reopened, but most of the other establishments will continue to be work from home. The testing, we hope, will be facilitated. More of the RT-PCR, more of the subnational laboratories that have been certified, and then guided by a guided use, some kind of guidance on the use of the rapid antibody tests. I think people are trying to understand this also, and trying to see how their actions will be after April 30.
John, you're on mute.
Thank you. I was too busy unmuting our speaker. Yeah, I wanted to ask you, Dr. Hassan, what you anticipate Malaysia's process might be as well as you start to move beyond control or containment and into thinking about reopening. Would it be a graduated process across the country, or do you think it will be a uniform lifting of the MCO?
Even in Malaysia, there's a hot issues at the moment. People are discussing on whether this MCOs is going to be extended for another cycle in 5 days' time. But we can see some findings already in terms of reducing the number of new cases per day, and there is no exponential increase in the number of new cases. So some group of people, especially on the economic side, start thinking of opening up as what we can see Philippines is trying to do. But there are a few parties also is very, especially on the health side, we are really still thinking that we need to do more towards that, because this is just a beginning for us to see the number of cases is reducing, everything. Especially we are thinking of whether if we remove we take out the MCOs, then how much we can cooperate and how much we can go back to the new normal to keep the social distancing and then break the chain of these infections. So that's an issue. So I'm not so sure what is going to be announced in a short time. But I think in terms of acceptance of our community towards MCOs after, this is our third cycle of MCOs after 2 weeks, and this is the third cycle. We have another 5 days. But in general, the population is started to learn of this, I think, of the normal, so-called new normal. And I should thank my government per se. Malaysian government is very much helpful to everybody, so that as for now, people are still, can continue their daily life. The government have come out with some kind of supports and into their economic plan, new economic plan to support those who has lost a job. So those who is working on day-to-day basis, so they are providing some incentive fund to them. Now they are starting to distributing the money to them, and also to the industries, to the small industries, So they are helping, the government is helping the people, so that that is very much helpful to the health sector, because we are really working on to break the infection chain by doing these MCOs and social distancing. But at the same time, the government also is helping people. You stay at home, we will help you at the moment with all with the financial support and also food. And I'm not in the position or to say whether the government is going to release the MCO soon. But looking at the situations now, we are doing very much. We're doing very good now. By like Farhan was mentioning just now, in some areas we do the extended MCOs. We contain the condominiums, so we contain where all the sports area. There are a few areas that we have done the extended. We really contain the disease. So I think the MCOs will not be released so soon. Just to share with you about the concern from Vietnam and Philippines just now about opening the restaurant, everything, that is very much concern to us too, because of course people will be rushing for food, everything. We are now very much not so-called dependent, but we are really being helped by the food delivery at the moment. Many of us is utilizing the food delivery and food hailing in our system. So it's very much helpful in keeping people at home and keep the social distance. And 2 weeks ago, we have tried to, there was an issues on opening up the barber services as part of the shops that we can allow to start operating. But of course, there are many suggestions from various parties, not only the health sector, thinking that even from the NGOs and public saying that, please don't open it yet. Because of course, you can't do those jobs without being close to each other. Right? So there will be no social distancing. So that worries us so much in terms of releasing the MCOs at the moment. But we will wait for another 5 days to see how it is. The government will start announcing soon.
Thank you. And last question for me, and then we'll try to get to some questions that are being posted from participants. But many models, many experts are predicting a second wave, a subsequent wave of infections that will spike perhaps later in the year. And some of that will be influenced by the way that governments and societies open up and start to relax restrictions in terms of maintaining distancing, even within the new normal. Can you briefly speak to the conversations that you're having about what the situation may be like in Malaysia if a second wave were to come? Where do you think you're going to be better positioned to deal with that than perhaps you were in the past month or so? And what are things that still need to be improved to make sure that Malaysia is ready for another spike in cases, as many of countries around the world are probably going to experience?
Of course, looking at a few models, people come out with, there are a few models come out to show that there will be a spike of cases in certain period of time. For example, last month, there's one prediction shows that there will be a spike of cases in mid of April. But with the implementations of MCOs, we can see that it is far from what has been expected or projected with all those models. So in my personal opinion is that, we're still thinking of there might be a second wave coming up, because we're still dealing with a new clusters coming out at the moment, like those who is among the workers, then among those who is coming back from overseas, everything. So, but looking at what we have been implementing on MCOs, we compare with the prediction models, I think we are prepared. Yeah, we are prepared for the next so-called predicted spike in the cases or the second wave in the future. Looking at what we are doing now at the moment. Yeah.
Thank you. And Dr. Berba, could you give your impression of or speak to the Philippine situation and what the conversation there has been in terms of potential future spikes in cases?
We're actually very worried about the immediately after the expanded community quarantine is lifted, how the surge will happen and how we will be able to again manage that surge. But I think we're a little bit more ready now. There's more. Also, I wasn't able to mention earlier. There's more of the trials now that will be starting very soon. The Philippines is part of the Solidarity Trial and other researches related to possible options in treatment. So that's in place, and our PPEs are in place. So hospitals are more or less more ready now to accept. Plus the fact that we have an enormous amount of support from the community. So the community quarantines have started last week, and more are starting this week to accommodate the mild cases that might happen should the surge happen again. So overall, I think we're a little bit more prepared now than how we were a few weeks ago.
Thank you. And Dr. T, would you like to comment on Vietnam and sort of conversations around potential future surges in cases?
Hello, can you repeat it?
Oh, sure. Just asking about what kind of discussions you and colleagues have been having about the potential for a future wave or a spike in cases following opening up after lockdown.
Oh, actually, we also discussed a lot before we have a proposal to the Prime Minister that we will continue involve the people from the community, because we have a very good system in Vietnam that we have a chairperson in the community, even it's large or small, and then we have a village health worker or village leader, and they will be the one who monitoring every household to see who is the newcomer. And we also encourage them that every household, every people have to awareness about the seriously of the pandemic. If it happen again, like we have to lock down for 2 weeks, that every people aware about it, and they have to get the responsibility to discover the new cases and to report to the health sector to have the immediately treatment and isolation. And the second one, we also continue quarantine at the border of the country, and also get the isolation all the foreigner come from the high risk country, that the high prevalence of the infection. And we will tracing the cases. If we discover the case with the positive, and then we have to tracing for the close contact with the one who have a COVID-19, and then all the health system from the very grassroots level until top up to the top center level, we have to take the responsibility. And the president also said that the head of every organization, every company, or every society have to take the responsibility for their staff. That means if the staff have a COVID, that means you have to take the responsibility, because not well communicate or not well training for your staff. Yes.
And this is a question from Nicholas Hing from Malaysia, which I think is a good one. You know, there's been a lot of collateral damage, for, you know, is the term he used, in terms of the healthcare system, where a lot of normal operations, normal functions of hospitals were sidelined in dealing with COVID-19 cases. What's it going to take to restore the public's confidence to know when it's okay to go back to the hospital for medical procedures, for things that perhaps they might be holding off on that they really need to do because of fear of going into a situation of intense transmission? Can you just talk through some of the steps you think in terms of communication from government to people or hospitals to communities to allow normal function to return? And we'll start, Dr. T, with you, if you don't mind. Hi, Dr. T. Can you hear me? Oh, maybe not able to hear me.
Yeah, Professor Huong might be having connectivity issues, but perhaps from one of our other speakers.
Okay, let's ask it.
Hi.
Oh, hi there.
I'm sorry because of the I cannot hear you. Can you repeat it?
Sure, no problem. It was a question from one of our participants from Malaysia asking about
Sorry,
how
my
hospitals.
Difficult to hear you. I turn off my camera.
Okay.
Yes, please.
Can you hear me now?
Yeah.
How will hospitals communicate to the public that it's now okay to come in for medical procedures unrelated to COVID-19 to begin to restore normal function to hospitals? What are some things that have to happen?
Oh, actually, even during the lockdown, all the hospitals still working because they have to receive the patient normally. But the thing I just mentioned in my talk is the people, the patient, especially the elderly people, even they know they have a problem with diabetic or heart disease, but they are afraid of the COVID-19 and they didn't go to the hospital. But the hospital is still running as normal, and every hospital from the central level to the district level still working. And we also prepare each hospital, they also have to prepare that with the scenario if they have a COVID-19 patient, what will they do, and they prepare for the isolation area, and they also prepare for equipment, medicine, everything in case they have a COVID-19. But in Hanoi or Ho Chi Minh or some other big province, we have some hospital called like a priority for the COVID-19 patient. But not just mean the other patient will not receive the COVID-19 patient. Yes. And up to now, the Prime Minister and also the Ministry of Health, we try to do our best to equip for every hospital to have a ventilator or equipment or PPE to prepare for at any time. If we have a case come, then they can prepare to dealing with.
Thank you. And just in our last minute, Dr. Hassan, do you want to comment a bit about the Malaysia hospital system and what the situation's been in terms of preparing to restore normal function?
Yeah, as for now, the healthcare system in Malaysia is working more or less like normal because for the COVID-19 management, only the specific dedicated hospitals, which is being designated to manage the COVID-19. So what the Ministry of Health, on the Ministry of Health side, what they did is that they start mobilizing the patients, the non-COVID patients to the other hospitals. We have many other hospitals running like at the state level, at the district level. So, and also we have the healthcare centers. So in terms of patient management, it's not very much affected towards the other patients. And even in my own hospitals, the teaching hospitals, we are actually having the contingency plan of which we continue with the normal services for the chronic disease patients. We even redesign our pharmacy into the drive-through kind of pharmacy. So it is quite a good approach by which patients can continue their medications, taking their medications. And for the patients who is not really it is a not chronic disease, it's a non-serious diseases. So we advise them to go to the clinic where it is not involved in the COVID management. So back to the normal healthcare systems, of course, it's not going to be like normal as before COVID. That's why we always call it as a new normal. But in terms of delivery of healthcare services, I think it's not very much affected in the future because we can always design and designate the hospitals. This is for COVID, and for those non-COVID, we'll go to the other hospitals with the precautions, of course, with all the precautions and guidelines. For those non-COVID, you have to be sure and take all the precautions with PPEs, everything, managing certain cases which is suspicious that could be COVID. Yeah.
Well, thank you. It's a real...
Can I have one more comment that actually during the lockdown in Vietnam, we also get some difficulty for the patient in the rural or mountainous area. They cannot travel to the province or central level hospital with the serious severely cases. That's why the government create the telemedicine. So for example, in our university, we have a university hospital, and then we set up a team and the telemedicine and connecting with the different province and different hospital at the district level, and our professor coaching for the doctor at the district level for the cases that they get the difficulty, but they cannot bring patient to the Hanoi or the big city for treatment. And we think that after this COVID-19, we also develop the telemedicine in our country. Yeah, I think it's also a good way.
I think telemedicine is going to certainly rise after this as a result of this. So a real test of resiliency. Well, that's our time now. I want to take a moment to just thank all of our speakers so much. Dr. Hassan, Dr. Farhan bin Rusli, Dr. Berba, and Dr. Huong. Thank you so much. It's been a terrific conversation. At this point, I'd like to hand off to my colleague, Dr. Jonna Mazet, who's going to close out with Dr. Pat. Thank you very much.
Thanks, Dr. Epstein. And I'd just like to echo your thanks on behalf of the One Health Next Generation. We're really looking towards building those future leaders and a strong workforce. And it's these kinds of events, and all of the speakers really generous and thoughtful, open sharing here that help us to just build a better future. And so to all of you, I say thank you, but I also wanted to just say how amazingly beautiful I thought Dr. Regina Berba's concept that she brought to us of, I'll say it wrong probably, but Bayanihan, and just thinking about the generosity, heroism, and spirit from communities that we're going to need to get through the rest of this as we all enter into this next level of social experiment of moving back into regular operations and working together if we have to go back into sheltering to keep things under control. So again, thank you, John, and thank the ECHO team as always for the amazing platform. And I'll just go to Dr. Vipat one more time for SEAOHUN as we're in this together. Pat.
Go ahead and unmute, Pat. It'll work.
All right. So thanks. So just a round of thanks to everyone, especially for the presenter, moderators, and all the participants, as well as the people supporting behind the scene in organizing this, and especially for our panelists who agree to come and share their experiences, given a short notice for that. So as people mentioned that we're trying to build a community of practice, so we're gonna gather every 2 weeks. So the next sessions that we're gonna have is gonna be on May 7th. And the topic there will be on the gender and psychosocial aspect of the COVID-19. So stay tuned for the information that's coming up and going to be distributed to everyone. So hopefully you can join us and also volunteer to share some of your perspective and experience. So with that, I turn the floor back to Bruce.
Great. Thank you, Pat. And I also want to extend my thanks to everyone. Hopefully you can see the end QR code here. And for those who were using the PDA app, this is a good time to go ahead and scan the end QR code, which will give you your attestation and give you access to Professor Bird's presentation. So again, thanks to everyone for participating, and